Welcome to the Wonderful Therapist podcast. I am Juan Gutierrez, your host and associate clinical social worker working under the supervision of a licensed therapist in California. In this podcast, we talk about psychotherapy, mental health topics, and have inspiring conversations. The information provided in this podcast is not substitute for mental health services. Any statements and opinions that I make are representative of myself and separate from my employer. Please share this podcast with friends and family and provide us with feedback or suggestions for future episodes. With that said, thank you for tuning in. Now, let's have a wonderful time. All right, in today's episode, we are going to define and talk about psychotherapy. The goal for us is to be able to understand what psychotherapy is and what is not. I hope to be able to define it in a simpler way, hopefully, and expand the details of the definition in order to increase the knowledge of psychotherapy and decrease stigma. So, let's begin with what is psychotherapy according to the dictionary. I'll be using the definition from the Merriam-Webster dictionary, and it states as follows. Psychotherapy is the treatment of mental or emotional disorders or related bodily ills by psychological means. If that is your first time ever hearing the definition of psychotherapy, that kind of sounds like you have to know a lot more in order to understand this definition. So not very helpful in my opinion as to help a normal person understand what to expect from therapy. So I want to look at the definition from some of the association and agencies that regulate therapists or those who are able to provide psychotherapy. So we're going to look at the definition of 4 definitions. The first one is a definition from the American Psychological Association, and it states as follows. Psychotherapy is a collaborative treatment based on the relationship between an individual and a psychologist. A psychologist provides a supportive environment that allows patients to talk openly with someone who is objective, neutral, and not judgmental. Now, the following definition is by the American Psychiatric Association, and it states as follows. Psychotherapy, sometimes called talk therapy, is a treatment that involves a talking relationship between a therapist and a patient. It can be used to treat a broad variety of mental disorders and emotional difficulties. The goal of psychotherapy is to eliminate or control disabling or troubling symptoms so the patient can function better. Depending on the extent of the problem, treatment may take just a few sessions over a week or 2, or may take many sessions over a period of years. Psychotherapy can be done individually, as a couple, with a family, or in a group. And then lastly, this is the definition according to the Board of Behavioral Sciences. That is the agency that regulates psychotherapists here in California. And this is the board that oversees my associate registration number and that of licensed clinical social workers. So I'm going to read a definition based on the licensed clinical social worker part or regulation policy. And it states as follows. Psychotherapy, within the meaning of this chapter, so there's bigger context, is the use of psychosocial methods within a professional relationship to assist the person or persons to achieve a better psychosocial adaptation, to acquire greater human realization of psychosocial potential and adaptation, and to modify internal and external conditions which offer affect individuals, groups, or communities in respect to behavior, emotions, and thinking, in respect to their intrapersonal and interpersonal processes. Page 100 of the BBS regulatory document for licensed clinical social workers. So those are the three definitions that cover the majority of licensed professionals. There are also licensed marriage and family therapists, licensed professional clinical counselors, and licensed educational psychologists. Those are covered by the Board of Behavioral Sciences, so I'm not going to go into that definition for those three. But what can we notice from these definitions is that they're using many different words that kind of seems like they're all defining psychotherapy in their own way. And unless you're trained or have knowledge in this field, in the mental health field, you may miss or not understand some of the meanings of those words. Also, I have to say this just for the agencies to consider this if they ever listen to this, that these definitions were not very easy to find on their website. It took a few maneuvers and going into some documents such as the BBS to find what they were defining as therapy for the public to understand or see. So it was not quite easy. Just throwing it out there. But we can see some commonality, some common thread that goes through the three previous definitions that we just read. And that is that therapy is a treatment or a service, and that is based on a professional relationship between a therapist and a patient. And a patient could be an individual as a patient, a couple, a family, or a group. Also, the therapist uses techniques and interventions to teach the patient skills for them to improve their quality of life. So, without trying to use so many psychological words, if we can call them that, in simpler terms, psychotherapy, and I will use psychotherapy and therapy interchangeably here in this podcast. Therapy is a service that one can use when dealing with an emotional and behavioral challenge that is affecting the daily living or relationship of the person. The goal is to reach a better state of mind and daily life functioning by learning how to challenge and manage/control the symptoms as you work together with a therapist who provides objective guidance, support, and challenges the patient by using strategies that are proven to help and improve different conditions. Also, you will learn about your moods, feelings, thoughts, behaviors, and yourself. That is like a simpler way of explaining psychotherapy, in my point of view, in one sentence. And how I typically explain it to my patients is psychotherapy is the act of noticing that something seems off in your life and that is affecting you, whether you know it or other people are pointing that out to you. And now you're entering in a relationship with a therapist to help you find a way to manage what seems off and improve your quality of life. Something seems off, it's affecting life. Let's find a way to help you manage it and improve your quality of life. That's how I like to explain it. That's how I like to define it to my kiddos. When I say kiddos, I mean I work with teenagers and children for the majority of my services. And there is a really good quote from the book, The Great Psychotherapy Debate, and it goes as follows, quote, psychotherapy is primarily interpersonal treatment that is based on psychological principles, involves a trained therapist and a client who is seeking help for a mental disorder, problem, or complaint, and is intended by the therapist to be a remedial for the client disorder, problem, or complaint, and is adapted or individualized for the particular client and his and her problem or complaint. I think that is one of the best definitions out there of what psychotherapy is. It's a really good book. Every psychotherapist should read this book, in my humble opinion. So now, let's start by defining or identifying what psychotherapy is not. The first one, which I think may cause a few of conflict, maybe, or argument, is that therapy is not counseling. I try to make it very clear to my kiddos, my patients, my families, that therapy is not counseling. Because in my mind and to my understanding, counseling is presenting the patient what may be the best route for them to take. Think of a school counselor, a financial counselor. These people that have something counselor at the end of their title typically try to provide a map or some sort of guidance as to the outcome that the patient should steer towards based on their knowledge and their judgment and what they may be seeing like the best outcome for their client. But therapy is not that. Therapy, we try to focus more on the patient trying to find out from within themselves what is the best solution for them to improve their quality of life through objective analysis. And I think objective is really important because our patient may think that what they think is best for them may actually not be the best choice objectively. Sure, it may be the easiest, simpler shortcut, but through that objective view, it may cancel out what they believe is the best for them, and therefore they will have to identify what is actually the best for them to improve their quality of life. This will make sense later, trust me. Secondly, therapy is not a psychological evaluation or testing. And therapists, or at least therapists with the master's level, we do not do psychological analysis or psychological testing. We're not psychologists. Some people use that interchangeably, but we're not. Psychologists can provide therapists, but not all therapists can provide psychological testing. So while you're in therapy or going to a therapist, don't think or believe that you're taking a psychological test. No, we are not allowed or trained to do that. So therapy is not a psychological evaluation / test. And also, and lastly, probably the most important one, is that therapy does not make perfection, or therapy is not a perfect machine. I explain this to my patients as much as I can. We're not aiming, seeking, or trying to find perfection by the end of therapy. We're aiming for progress and improvement in the quality of life, because perfection is subjective, and also in some cases perfection can be impossible, plain and simple. So we're aiming for progress and improvement of the quality of life. So now that we have addressed what therapy is not, let's talk about a bit more about what therapy is. And we're going to expand in the definition of some of the different components of the words that were used to define therapy. So the first and probably the most difficult part about therapy is that therapy help us understand our past, and in that teaching or realization of exploration of our past, it can actually become an intense service because it deals with patterns of behaviors and thinking that are affecting our life, and that we are set on them, and that we have been doing them for many, many years. Some of them are traumatic, some of them are intentional, some of them we don't even know we're doing, but we're doing. And it's difficult to adjust and change our behavior. And that is typically the difficult part of therapy. Finding the changes that are needed to improve the quality of life, that could be difficult as well. But working on those changes and committing and applying those changes requires a lot of discipline. And that could be the part that is difficult. It really is difficult. Maintaining those changes after patient achieves them also requires commitment to stay in the plan that they have agreed to continue to practice the skills. That requires commitment. And there are also risks to therapy. This is the other difficult part of therapy, is that you may talk about uncomfortable experiences and make you feel painful and uncomfortable feelings and thoughts. But the goal of therapy, if you go through the process and commit to the work that you're doing on your own outside of the office, if we can call them that, the goal is to minimize the risks by learning skills that lower the intensity of and pain of those uncomfortable feelings and thoughts. So that is the difficult part of therapy. On the other side of the coin, there's also a very bright and joyful part of therapy. One of the reasons is that therapy can actually be fun. That's my number one point that I'm going to start with, because unlike popular belief, I really think therapy could be a fun time. You should, I think, you should have humor relief, and have a good time with your therapist, because, and this comes in the following points, because therapy is enlightening. It gives the patient that sensation of aha, moment, or that moment of realization of, oh yes, or helps the patient increase their knowledge or wisdom to make better choices. Sometimes therapy can give you emotional relief. I mean, people sometimes they hold secrets for many years, or trauma for many years, and they never talk about it until they talk about it with a therapist, and the emotional relief they feel is incredible. Other times there is a sense of freedom. It goes together with the previous point. This freedom of being able to talk about your issues openly with someone, and being honest with someone, and knowing that the person sitting across from you is going to hold that information private and not share it with the world or criticize you. So there is freedom. And then lastly, like, it helps you improve your life. It just helps you, hopefully helps you make your life better and resolve the problems or the challenges that you were experiencing. So through all this, I really do believe that there should be a component of fun in therapy, because I do believe that emotional relief can be at times comical. And we look at the decisions that we made in the past and, in a way, figuratively or literally, laugh at ourselves because of the mistakes that we made. But we learn and we grow, and that's the hope, is that it helps us grow. So therapy should be fun. Just keep that one in mind. The next part about therapy is the exploration part. The majority of the time, if not all the time, therapy should be challenging, or at least I think it should be challenging, because therapy has us reflect on our past and our present and on our future, and that is challenging, believe it or not, because our past may contain traumatic events or negative experiences that are affecting our present life, our present self. Maybe our current lifestyle or conditions are influencing our mental state, and that is not allowing us to enjoy our functioning in the present. Or we could be so worried or obsessed about potential future outcomes or what could happen, that we're not able to enjoy the present. And if you notice, using a lot of emphasis on the present because that's what therapy is about. It's about working on your present condition and being able to help improve your quality of life in the present. We can't do anything about the past. We cannot control the future, but definitely the present, that's something that we can work on. So who guides the therapeutic process? Well, the process is guided by the support of a mental health professional. That is a mental health professional that is trained in psychological and therapeutic strategies, or skills to address the challenges and the barriers that are affecting the functioning of the patient. And just a quick side note, please, and make sure that the person across from you that is claiming to be a therapist is registered, licensed, trained, and has appropriate education to provide psychotherapy, please. And what are psychological strategies? Those are tools that the psychotherapist is using and that learned or was trained in order to help the person alleviate the symptoms that they're experiencing. And there are different types of therapy styles. We call them modalities. So it's like different type of approaches or different type of techniques that are helpful to address a certain issue. We'll talk more about therapy modalities in a future episode, but that'll be it for right now. So where does the therapeutic process, or where does therapy takes place? First, I just want to dismantle an old-time belief that therapy is the patient sitting on the couch, staring at the rest of the room or the ceiling, and the therapist taking notes as the patient just talks and talks, and the therapist asking the question, And how does that make you feel? It's way more than that. Um, Therapy can definitely take place in an office, but it can also take place outdoors, outside the building. It can be in a hiking trail. It can be riding a horse. You could be in the office with the therapist. You can be in the office with your partner, with the family member, or a group of people, and the therapist is guiding the the session. So it doesn't always have to be this, old school picture that we have of one person sitting in the couch in an office with medium light and lots of books and the therapist just taking notes. No, that's definitely not therapy all the time. And also, it doesn't have to be just talking and talking. It can include music, it can include videos, board games, art, sand, toys. Like I said on the previous point, there's different styles. So therapy is not just talking. And, we're all different in the way we think, the way we feel, the way we process information and express our feelings. So therapy is going to look different for everyone. Levels of language, people don't talk at the same level or even the same language. So yeah, it's going to look different for everyone. Also, their ability to understand their, cognitive functioning, the way they process information or recall the information, everybody's different. So therapists have to adapt to that. So it's important that you find the right therapist. And we'll talk more about that in future episodes on how to find or what to look for in a therapist. The next point is, do you always talk during a session? The answer is yes and no. I briefly mentioned right now that you don't always talk in therapy. There are other things that you can do that are considered therapeutic. So yes and no. Talking is important, so that to know the challenges that the patient is experiencing. There are many interventions that are therapeutic, like playing a game, drawing, writing. All those can provide a therapeutic a therapeutic moment. I'm catching myself using words, lingo, therapeutic lingo. But these activities like drawing can help you process your feelings and express your feelings. And honestly, sometimes just silence is therapeutic. Sitting across someone in silence when you're so upset or sad, it actually helps the person. I've seen it worked. I've done it. It's actually pretty incredible. But there is a balance between talking and asking questions from the patient and from the therapist. The patient is not always talking. The therapist is not always talking. The patient is not the one always asking the questions, or the therapist is not the one always asking the questions. There is a balance between those two roles. The therapist talking and asking questions, listening, the patient listening, asking questions, and talking. It's a balance, and it changes from session to session. So it all comes down to the dynamic that you have with your therapist. And it's important to consider that. It's the relationship, what it's called the therapeutic relationship, the relationship between the patient and the therapist. So what's the goal of therapy? I have a quote from a book called Persuasion and Healing. And it says, "The aim of psychotherapy is to help people feel and function better by encouraging appropriate modifications in their assumptive world, thereby transforming the meanings of experiences to more favorable ones. Close quote. The goal of therapy is to help the patient improve their quality of life. Bottom line. It's a great responsibility from the therapist, but it also requires a lot of commitment from the patient. The therapist doesn't do all the work. Also, the patient doesn't do all the work. But it requires the most commitment from the patient in order to progress. Every person is different. Every person has different goals. And thereby, therapy is going to look differently from person to person. Therapy is not a cutting approach. It changes, it's evolving, it's modifying itself from session to session based on the relationship between the therapist and the patient. Also, note that not everyone who goes to therapy has a mental health diagnosis. And that is why goals are tailored to each person individually. Because the fact that you're in therapy doesn't mean that you have a mental health diagnosis. And because you have a mental health diagnosis, it doesn't necessarily mean that you're never not going to be able to learn how to manage the symptoms. So that's what the quote. I wanted to bring up the quote because it changes the meaning of their experiences, what the patient is experiencing, to a more favorable meaning. The challenges that you're having, the goal is to make those challenges, learn from them, make them more of a learning experience, and give them meaning, and have them work towards your favor in life. So, to end this episode, I have one last quote from the book, The Great Psychotherapy Debate. And it goes as follows. Psychotherapy provides the client a human connection with an empathetic and caring individual, which should be health promoting, especially for clients who have impoverished or chaotic social relationships. That is as good as it gets. So psychotherapy provides a client with a human connection. Therapists are not machines. We're not robots. We're humans. And in that therapeutic relationship, there is a human connection. And our goal is to care for our patient and provide empathy. So yes, you should feel care by your therapist and feel that they're giving you empathy. And also that they're helping you improve your social relationships. So that's it. That's what therapy is. It's a human connection that helps you better yourself and improve your quality of life. Thank you for listening to my long definition of psychotherapy, but I think it's really helpful and important, and the heart of this podcast is to understand what therapy is. So that will be it for today. In the next episode, we're going to talk about who is a therapist, and we'll go a little bit more into the nitty-gritty of who is really a therapist or who is legally able to provide therapy. Thank you so much for tuning in. I'll see you next time.